Just getting everyone in focus here.
15 seconds. Just rolling a special open for this one. 10 seconds left to go, and then we're going to do a throw, and I'll be throwing.
I always take requests here. Hey, right on. Good afternoon, everybody. I'm Adrian Dix. I'm BC's Minister of Health. Joining me today is Dr. Bonnie Henry, BC's Provincial Health Officer. And I want to start by acknowledging the territory of the Musqueam, of the Squamish, and the Tsleil-Waututh. We're honored to be giving this presentation on their lands. Today we're here to provide an update on what to expect in this year's respiratory illness season for our healthcare, and our healthcare system. And it's my honor to begin by introducing Dr. Bonnie Henry to discuss the respiratory illness season. Dr. Henry.
Thank you and good afternoon. Whoa. I just want to start as well by acknowledging that coming up this Saturday is our National Day of Truth and Reconciliation, September 30th, and I encourage everyone to actively participate in learning the truth about the residential school system, Indian hospitals, and the impacts it's had on First Nation communities across this entire province, and actively advancing together and elevating true reconciliation as a way forward for us in this country. So today we're going to talk about protecting BC in this respiratory virus season. And let's see if I can make this move. To actively participate in learning the truth about the residential school system, Indian hospitals, and the impacts it's had on First Nation communities across this entire province, and actively advancing together and elevating true reconciliation as a way forward for us in this country. So today we're going to talk about protecting BC in this respiratory virus season. Let's see if I can make this move. Okay. First, I want to give a sense of what happened last year and where we are to put this in perspective. So last year, we saw the return of other respiratory viruses like influenza and RSV, amongst a number of others. And you can see on this graph, the green, for example, are enteroviruses and rhinoviruses. Those are the cold viruses. And we've seen those persist through the summer as well. To summarize it up, what we saw last year was that SARS-CoV-2 really was fluctuating through the year, mostly in adults and causing more severe illness in adults, and we'll talk a bit more about that. We had a relatively early influenza season with a sharp, short spike, and it impacted children more than we have seen in the past. As well, we had a relatively severe RSV season, which also affected mostly children, higher than our historical averages. So we know that much of this is related to the fact that we had return of global travel and that these viruses circulate with people and we move around the globe. And it's important that we recognize that this movement of people is also part of how we, important for our economies, important for our health, important for being able to get together after the years that we've been through. The Southern Hemisphere can give us some indications of what we might expect this year. And what they saw was, again, variable COVID over the period of their respiratory virus season. They also saw influenza H1N1 and influenza B. And we're starting to see that that might be what we would see here. Again, those are viruses that particularly affect children. So that's something that we'll be looking out for. And they also saw a variable RSV season. So I want to go back and just look a little bit and put it in context for what happened in BC last year. So as I said, in the blue there, you can see we had an early sharp influenza peak. But if we break it down by age, we can see that very young children are the ones most affected. So infants up to 4 years of age in particular, but also children and school-age children as well. And with all of these viruses, we know that people over the age of 70 have the highest risk of having severe illness, ending up in hospital, or having complications from these viruses. So we have that U-shaped curve where very young and older people are more affected. We also saw that COVID particularly affected older people, while there was also some increased activity in the very young who are most at risk. People over the age of 70 were more likely to have severe illness, more likely to end up in hospital. So the double risk that they have of these two viruses really speaks to the importance of the protection that we need from the updated vaccines, both for influenza and for COVID. So this slide is a little bit busy, but I want to talk to it for a minute. We know that protection from vaccines and from infection wanes over time, so it decreases over time. But there's two different parts to that is important. It never goes back to zero. So what we know from the seroprevalence, so that's that graph on the top, the seroprevalence, that's markers in the blood of people who have antibodies against COVID. And we know that some of these antibodies are from vaccine, and some of these antibodies can be from infections. So that's the bottom line. What we see is that over time, just about everybody in this province has some protection, has antibodies to COVID-19. And that's a combination of vaccinations, people having 2, 3, 4, sometimes 6 if you're somebody who's immune compromised, and having infections. Particularly, we've seen those infections markers increase since Omicron started. Many of these people, particularly people who are vaccinated, didn't even know that they had an infection with Omicron because they had protection from severe illness. So that's the thing that's important. It never goes back to zero. We know we have this cell-mediated immunity or memory immunity, and once you have vaccinations or combinations of vaccinations and infections, that immunity is long-lasting, and we're learning that now from the studies that have been done over time. We also see that this hybrid immunity is different in different age groups. So what does that tell us? That tells us that young people are more likely to have had combinations of vaccination and infections. We know that people who've had no vaccination, most of them have had some indication of infection if you're younger, but those can wane over time. So unvaccinated people remain most at risk for severe illness and hospitalizations as we're heading into this next respiratory virus season. We also see that older people are less likely to have markers of infection. And what does that tell us? That tells us that vaccination has been really good at protecting older people. But it also means that they don't have this hybrid immunity, and it's really important that we get boosted and we get this updated vaccine to protect us from infection with the viruses that are circulating right now. This is also relevant to the healthcare worker mandate, because if we look at that age group that most healthcare workers are, we know that all healthcare workers in our system right now have vaccination. Most of them have multiple doses, at least 2, but almost everybody has had at least 1 booster. And we know that many of them also have hybrid immunity. The majority of us have hybrid immunity from infections and exposures to Omicron over the past year. So that gives us a really good buffer. But what we need to focus on now is this updated vaccine that will protect us from what's going around right now and give an extra boost to that long-term immunity that we still have. So this is the graph of what we're seeing right now in terms of COVID specifically for hospitalizations on the top and critical care admissions and deaths. So the hospitalizations are test positive. So people have a PCR test, and we know that mostly that's people who are in hospital for other reasons, and or people who have more severe illness, so they get a test from their doctor, a PCR test. For this, we recognize as well that test positive in hospital people, and people who are in hospital, about 40% of those cases are people who are there because of COVID. And we know right now we've had a bump up in the last few weeks because there's been a few outbreaks and clusters, and so we've been doing a lot of testing at people in hospital. So it's a combination right now of people who are asymptomatic, people who have been in hospital for something else, who got a COVID test that's positive and that we need to pay attention to, and for people who actually do have COVID. So those are things that we follow over time, and it tells us that, yeah, we're starting to see more COVID in the community, and I think that's no surprise to people. We're also starting to see other viruses that cause infections. We're seeing a little bit of influenza. We have not seen much RSV yet, but those are the ones we're looking for. Throughout this pandemic, whole genome sequencing has become a really important tool that helps us understand how the virus is changing over time. And this is something that we know all viruses change and they mutate as they try and be better at infecting people. And what we've seen, and it's sort of in big letters there, is really since early 2022, it's been various different strains of Omicron. And it's a key part of understanding the changes. And it is relatively new technology. This is the first time ever we've been able to sort of watch a virus change in real time. So we sometimes pay a lot of attention to, oh, it's XBB 1.5, it's XBB this, it's EG 0.5, and those are the ones that we're seeing circulate around now. But really, what we want to know is the vaccine still going to protect us? What is the advantage of this virus over the previous ones that were closely related to it? Is it causing more severe illness? So those are the things that we are monitoring as well. Right now, what's important is it has been Omicron. There's been slight changes, so these are all related to each other. What we're seeing here in British Columbia is XBB 1.16, EG 0.5 are the ones that we're identifying most commonly. So far, we've only had the one identification of BA 2.86, which is a slightly distant cousin. But there are many, many other slight variations that are circulating around here now as well. And the important thing is, studies are shown from the clinical trials, from lab studies that have been done, that the vaccine that has been developed, this new updated vaccine, XBB 1.5, it's based on that, shows good protection against all of these ones that we're seeing circulate right now. So that's good news. I want to also say just a word about testing. So the rapid antigen tests that are still available around in pharmacies right now, they still work. And we've been monitoring those to see if they pick up these new strains as well. And they are still helpful for people who are isolating at home and have milder illness. It helps you know if it's COVID. But we need to remember that COVID is not the only virus that's causing people to be sick right now. Just to move on, one of the other tools that's been so helpful for us since the pandemic started is looking at wastewater surveillance. And what that gives us is a sense of trends over time in different communities. And as you know, we've expanded the wastewater surveillance to more areas around BC, and it helps us as a passive way of looking at trends. So all of these are pieces of a picture that help us understand what's going on right now. So we are seeing gradual increases. It's still relatively low, but gradual increases across the province. What will be new over the next few weeks, you'll see, is that we've been able to, the scientists and clinicians at the BC CDC have been working hard to validate tests for other respiratory viruses that we can check in wastewater as well. So it is kind of exciting that we're doing this. It's new in Canada, and we'll be looking for influenza A, but also for RSV. And we don't know a lot about RSV and what strains circulate and how it changes over time and why some years we have more severe seasons than others. So all of these will be available in the BC CDC dashboard that you'll be able to follow over time as well. The other addition that we're adding that's new this year on the dashboard is emergency department visits for what we call the syndrome of respiratory illness. So it's how many people are presenting to an emergency department with a cough and a fever and other signs of respiratory illness that are indicative of what's going on in the community. So it's a syndrome, we call it syndromic surveillance, and you'll be able to follow that over time. And what we're seeing right now in this picture is that we're starting to see a slight increase. This will also be available on the new dashboard. So just to put this up, we've been reporting monthly over the summer when when rates of respiratory illnesses were low across the province. And now as things are ramping up, and we know that we traditionally see more respiratory illnesses as we go into this season, we'll be increasing the frequency. And so starting October 5th, these will be available on the BC CDC website on a weekly basis. And you'll be able to look at all of the COVID-19 updates, but also the respiratory disease updates all together on that webpage. So that's important. That's what will help us know where we're going and the trajectories over time. So what else do we need to do to prepare as we go into the fall? It's really going back to what we all know, and sometimes maybe a bit tired of, but the healthy habits that keep us from getting sick ourselves and also keep us from passing it on to others, particularly to our loved ones and others in our community. So we know that influenza, COVID, RSV, enteroviruses, adenoviruses, all of those things that cause respiratory illnesses tend to come back as we go into the fall and winter. Really important is staying up to date on both influenza and COVID vaccines, and I'll talk a minute about what we have available for those. Staying home if you have a cough and a fever, those are signs that you're infectious to others and you need to stay away. Particularly staying away from people who are more vulnerable. So if you're not feeling well yourself, even if it's mild, don't go visit somebody in a long-term care. Postpone that visit if you can, or take precautions to make sure you're not going to expose somebody who might be more at risk. Cleaning your hands regularly, covering your coughs and sneezes, even wearing a mask if you have mild symptoms or if you're recovering and you're going to be in an indoor space with people who might be more at risk. I do want to say a minute about testing. I mentioned that the rapid antigen tests that you can get still work, and they're important to use. They can tell you if you have COVID, but they won't tell you if you have influenza or one of those other viruses. So even if it's negative, it's important to stay home and stay away from others until your symptoms have resolved, and particularly until fever has resolved. If you are somebody who's higher risk, or you have more severe symptoms, then you should see your healthcare provider. And in that case, you'll likely get a PCR test. And as we did last year, all of the PCR tests, they go to the lab, they're tested for 5 viruses. So it's called a multiplex test. So it tests for influenza A, influenza B, for COVID, for RSV, and for another common virus that can cause some severe illness as well, parainfluenza. And that's important. If you are somebody who's at higher risk, you can have access to antivirals that can help treat influenza and to medications like Paxlovid for COVID. So the updated COVID-19 vaccines are available. They're just starting to come into the province now. The recommendation is you get it about 6 months after either your last known infection or after your last dose. But we know that this improves long-term protection, so you get the best longer-term protection if you wait about 6 months. But we also know that this one is tailored to what we're seeing circulate right now. So it prevents infection. So it prevents us from getting the virus causing infection in the first place. That immunity, the antibodies that give you that protection against infection, they increase, and these are questions that I've been asked quite a lot over the last little while. So it's not immediate. It increases about a week to 10 days till you get that maximum protection. And what we're learning is that after each dose, that maximum protection against infection can last for 2 to 3 months. So we want you to get the vaccine, and that's the timing. We want you to have that best protection during the period of time when the risk is greatest. The other thing, though, is that cell-mediated immunity, that memory immunity, and it gets a boost from this vaccine as well, and that lasts quite a bit longer. So we know that these are both mRNA vaccines. Oh, yes, and the big news today is that the Pfizer Comirnaty Omicron vaccine was approved for use by Health Canada this morning. So we have the 2 mRNA vaccines that have been approved by Health Canada, and that will be rolling out in the next few days and weeks here. Everybody 6 months of age, and these are approved for use for people 6 months of age and older. And we're still waiting for the Novavax, the protein vaccine. but that has been submitted to Health Canada as well. So that's the COVID vaccines. In terms of influenza vaccines, we have a variety of injectable. Just to remind people, there's a nasal spray vaccine for young people. It's approved for use in 2 to 17 years of age. And we have 2 vaccines, 2 enhanced vaccines for seniors over 65 years of age. Both of these vaccines, the Fluad, which is an adjuvanted vaccine, and the Fluzone High Dose, give added protection for seniors and have been proven to provide added protection for seniors. So those are available as well. Our campaign will be starting as soon as vaccine comes in, and we are starting with long-term care even this week. But the public campaign will really launch in earnest, so most people will expect to start getting invitations to get your vaccinations starting right after the Thanksgiving weekend around October 10th. We are rolling out, as I mentioned, priority groups early on, and everybody should be familiar with the getvaccinated.gov.bc.ca. You can register, make sure you get your invitation, or the call center number remains the same as well, 1-833-838-2323. And I do encourage people to get both vaccines at the same time. If you're not yet due because you've just had a recent booster for your COVID vaccine, important to get your flu vaccine and then get that one when you're due. And there will be over 1,300 pharmacies around the province that will be offering both vaccines and additional capacity from public health units. Just to remind people that in terms of eligibility for both vaccines, they're free for everybody in BC 6 months of age and older. We are going to invite priority populations first for the reasons that I just talked about. We know that most people who are over age 65, who are immune compromised, it's been some time since they've had a vaccine that gives them protection since the spring dose. And we know that most of them, the vaccines have prevented them from getting sick with the virus. So they're the ones who need it first. We'll be also providing it to residents of long-term care home, people who are pregnant, and infants and young children. In particular, we want to make sure they're protected against influenza because we know that they can get severe disease from influenza. And we'll be rolling it out to healthcare workers as well as soon as it's available. Finally, I just want to talk a little bit about additional infection prevention and control measures in healthcare settings. And so this is something that as we had low levels of respiratory viruses circulating through the summer, we were able to remove some of the additional precautions that were needed in healthcare facilities. But starting next week on October 3rd, we're going to be putting back in some of the measures to make sure that we're doing our best to protect people who are most vulnerable in those settings. So active screening for symptoms, you'll be asked at the door whether you have respiratory symptoms. Visitors who do will be asked not to attend, particularly in long-term care. We know that it's really important to protect our seniors and elders in care. Healthcare workers as well. We have a process for doing self-screening, for making sure that we have return to work guidance and know what to do with that. Increased hand hygiene, increased cleaning, what we call respiratory etiquette, making sure you cough in your sleeve, clean your hands regularly. And the ambassadors will be back at the doors of the entrances to healthcare facilities and to long-term care homes to do the active screening, make sure people have access to masks. And finally, medical masking will become a requirement again, continuing medical masking by healthcare workers, visitors, contractors, volunteers in patient care areas. So really focusing on those areas where people are at risk. And that includes all health authority, hospital, clinical settings, all long-term care homes, seniors assisted living settings, private hospitals, and private mental health facilities. We are trying to find a balance, particularly in long-term care, of finding safe times for visitors to long-term care to have that important face-to-face contact with their loved one in a safe way. So visitors to long-term care must wear a medical mask in all common areas and when participating in any of the indoor events that are happening. But we'll be finding opportunities for them to have FaceTime with your loved ones as well. We know how important that is for the health of residents in long-term care homes. So that's the summary of what we're seeing. So really important, get up to date on your vaccinations. Expect to wear a mask if you're in a hospital or a healthcare setting in the next few months. And that's the best we can do to protect each other and to make sure that we can slow down and decrease, minimize the impact of these viruses on ourselves, on our communities, and on our healthcare system. And I'll now turn it over to Minister Dix to talk about the healthcare system.
Thank you very much, Dr. Henry. I'm going to talk a little bit about our preparations for respiratory illness season in the healthcare system, and in particular in acute care. You'll know you got control. Excellent. You'll know some 25 hospitals throughout the summer. We saw acute care census, meaning the number of people in hospital, 500 or 600 more than we'd usually see in summer. And this slide speaks to that. We have approximately in September, 350 more than we'd ordinarily seen, which is, to say the least, a significant number of people to be taken care of. You'll also note that last year, on January 6th, we reached 10,280 people in acute care. And at that time, we took even more measures to address that situation and to ensure that people were able to get care safely. And so that's the circumstance that we're in. We're seeing in our public health care system is delivering more care, treating more people, doing more surgeries, more primary care visits, more ambulance calls. And our healthcare teams have been extraordinarily resilient to all of that. But we have to, as you would expect under these circumstances, continue to prepare and enhance those services this winter, and that's what we plan to do. On the next slide is a little bit about that preparedness. Through each wave of the COVID-19 pandemic, our healthcare system has learned and adapted to meet patient needs, and we're continuing to do that today. In preparation for this respiratory illness season, health authorities have improved access and flow teams in place for all large hospitals 7 days a week. Focused teams of healthcare leadership, administrators, and physicians have been established on critical care and emergency departments to support these priority services now and in the future. Health authorities, BC Emergency Health Services, the Ambulance Service, and the Ministry of Health continue to coordinate our provincial capacity, meeting daily to share situational awareness. It's a day-to-day, consistent management of the system that is 7 days a week. And as a backstop to all this, we have formalized a standard provincial surge response plan, taking the best of our response to COVID and learning from it. We'll go to slide 21. We continue to advance our health human resources strategy, which is key to all this. And I just want to note a couple of things that you'll see on the slide. Firstly, since January, and this is just January to the present this year, we have 5,221 net new nurses in British Columbia. That's net new, meaning that's the increase in the number of nurses across the province according to the college. And the college is also prioritizing 2,800 internationally educated nurse candidates that are either in the province or from countries where nurses are more easily able to integrate from and work in BC. In addition to that, we have this year so far at the College of Physicians and Surgeons registered 524 more internationally educated medical graduates. That's in the first 8 months of this year, of the 2023 year. Put that in context, in all of 2022, which itself was a record year, it was about 400. So we would expect that number to double in 2023, reflecting the changes that have made to improve pathways for internationally educated medical graduates and other actions like the tripling over the next 2 years of the Practice Ready Assessment Program. As of September 28th, 3,729 family physicians are practicing under the LFP compensation model, this transformational change that we developed with our doctors in British Columbia for primary care for family doctors. 207 family physicians have also now signed new to practice contracts. These are new doctors in British Columbia to provide family medicine. And 196 nurse practitioners are on contract to provide primary care. In addition, our HCAP program, as we've been talking about long-term care, 6,546 healthcare assistants have been hired through the Health Careers Access Program since its inception. This is inclusive of the 979 that have been hired this year. In addition, of course, thousands of healthcare workers have been hired in long-term care to support infection control. Go to the next slide. And so what we've seen, in addition to that, is other programs designed to assist this response, continuing response to the healthcare needs of British Columbians. Go Health BC, the Emergency Health Provider Registry, and the new Provincial Emergency Department Physician Locum Pool are three initiatives that will help meet demand this fall and winter. There are over 73,000 hours of nursing support to 23 communities provided by Go Health BC, the provincial travel resource program that's operated by Northern Health. We are also doing a refresh of the Emergency Health Provider Registry. Currently, there are 6,113 recent registrants, including 403 physicians and 3,233 nurses. We also have 134 physicians registered with the Emergency Department Locum Pool, which will help with keeping community emergency departments open. The next slide. And obviously, responding to respiratory illness season is not just a matter of hospitals. We've discussed primary care, as emergency departments and hospitals are not always the best places for patients to be. Health authorities are readying their hospitals, and they are ensuring that access to care in the community is in place, as are linkages to community supports to people so that they don't have to go to an emergency department if they don't need to. Everyone who needs to go to an emergency department, of course, every day, should go. These actions include expanding the capacity of urgent and primary care centers and working with BCEHS to make this an alternative for some patients. The next slide. And now I just want to turn and discuss a little bit about beds, which I discussed a little bit earlier in terms of our healthcare system. Just to say that that obviously this has been is a significant focus and has been. When we took, as you know, in January of 2023 this year and previous years, significant action to support and to address healthcare beds in BC. Our historical in the pandemic, in fact, I would say, has required us to examine every facet of our healthcare system to ensure we know precisely what assets we have that we could use, and in some cases that we need more of. Sometimes it represented an inventory. You've heard me talk about PPE often in response to the COVID-19 pandemic. Other times supplies, such as that. But it was always about ensuring we had the latest, most accurate information. In our surgical renewal commitment, for example, we did an extensive review of surgery wait lists that brought significant new accuracy to those lists. And as you know, extraordinarily, during a pandemic, we've done record numbers of surgeries. And in the month of August, thousands more surgeries than we did in the August prior to the pandemic. And so we've now, we've done this same process with hospital beds. I can tell you that we've done that extensive work over the summer to prepare for respiratory illness season. Our historical base bed count in BC, as you've heard me say many times, is 9,202. On top of that, during the pandemic, we had 2,353 surge beds that we had access to as well. We are now resetting the new base bed count to 9,880 beds. To achieve this, health authorities have identified which beds could be regularized, are clinically equipped, and are use appropriate. The benefit of regularization means staff are no longer in temporary lines, that regular positions are created, that appropriate support services are hired, and that overtime can potentially be reduced, all of which will lead to more patients getting safer care with the right level of wraparound services. In addition, health authorities have confirmed that we will add on top of that the capacity for 1,500 surge beds, which, if needed, could be activated in the fall and winter. And so that's where we stand now. I think the message today is pretty clear. We need and we want everyone, when they're invited to do so, to get vaccinated. It's important for influenza. It's important for COVID-19. And Dr. Henry has laid out in detail the reasons for that. We need to use our COVID sense. That means continuing to wash our hands, and most importantly, staying home when we're sick and wearing masks where appropriate. The mask requirements in our hospitals and other healthcare settings are there to protect those who are in those circumstances, both those working and obviously people who are the most vulnerable, people who are in those healthcare settings. And we have to continue to work together. It is and continues to be a challenging time, but we know in this year of the COVID-19 pandemic, this fourth year, we know what to do. We know these things. We know we need to get vaccinated. We know we need to wash our hands. We know we need to wear masks. We know what to do and what we need to remind ourselves of during this season when we're going to see more respiratory illness in the community, to continue to take those actions that we need to do. And together we can respond effectively to what continues to be a challenge for all of us. I want to thank everyone who works in healthcare, from the healthcare assistants who have done an exemplary job in response to the challenge of providing long-term care services, the healthcare workers who helped move a record number of people in long-term care during the wildfire season, yet another challenge they faced and performed in an exemplary way. And I want to particularly highlight the work of BC Emergency Health Services and our ambulance paramedics in that regard. Everybody is working hard, and we have to continue, though, to work together, and we need everyone to be part of that. So that means get vaccinated and use our COVID sense. Thanks very much, and I'm going to invite Dr. Henry back to the podium for questions.
And now we'll go to questions. As mentioned previously, if you'd like to ask a question, please press *1 at any time and you'll be placed into the queue. A reminder to please unmute your phone, as you will not be audible until your name is called. The first question is from Rob Buffin, CTV. Rob, go ahead.
Oh, hi. Thanks for taking my question. I guess my first question would be for Dr. Henry. I'm just wondering, we've heard, as I understand it, about 80% of BC residents have now had COVID. This situation has gone on for many years. My question is, are you concerned that uptake on COVID vaccines, especially because people know the virus causes less severe symptoms for many now, uptake is going to be much lower than you would like? And what do you think uptake will be?
I hope that people will recognize that this is an important step. It's been a long time since most of us have had an updated vaccine. And for those who've had COVID and recognized it over the summer, it's not a pleasant infection to have. And there's still that risk of developing long-term symptoms. So this is the best protection that we have that will keep us from getting sick during this next few months, and continue to boost that protection we have for long-term protection against severe disease. You know, I think about the U.S. is marketing it as these vaccines, like we see with influenza. These vaccines go from wild to mild. They're really important in helping make sure that we're not going to be out of commission if we're young and healthy, that we're able to continue to go to school, to continue to go to work, for healthcare workers, for us to be able to make sure we're not taking it home from work, that we're staying well ourselves. So it is an important vaccine. It's an updated vaccine this year that's going to protect you from what we're seeing right now.
Rob, do you have a follow-up?
I do. I just want to confirm and clarify that I understand correctly that masks will indeed be mandatory in the various healthcare settings that you'd set out for the people who are required to wear them. It's not a recommendation, but it is mandatory. And I'm also wondering, you know, there's groups like Protect Our Province who've called for masks in places like schools as we get back into this season. Why not require masks to be worn in schools as well? But I do really want that clarification on whether masks are mandatory.
It is a requirement, yes. They are mandatory in those settings, in healthcare settings. And we've said this all along. You know, there's different risks in different settings. And we know that people who are most vulnerable, elders and seniors in long-term care, people are in hospital for a variety of reasons, many of whom are immune compromised or older. They're the people who need this protection the most. That's where it makes the most difference in terms of having these layers of protection. We know that all healthcare workers are vaccinated. Many many, the majority have a hybrid immunity as well. We're going to step up and get the additional protection from this new vaccine. The new vaccines, influenza is also important. And so it makes, it's really important that we add that extra layer for people who are going in and out of these most high-risk settings. We know that schools have a variety of different parameters. Schools are not the same as a hospital. The most important thing we have in schools is that people stay home when they're sick, that we have provisions for that, that we've looked at ventilation, that we have a known population. It's not a bunch of different people coming and going like we see in an acute care facility, for example. So there is other measures in place that protect schools, and we've seen that schools are a very safe place for children. It doesn't mean that children don't get respiratory viruses. Of course they do. We know that. We've seen that every year prior to the pandemic, and now we have another one that's in the mix, and that's the SARS-CoV-2 virus. So we need to pay attention to all of the things that we would normally do and need to think about it in terms of all of the respiratory viruses that are out there.
Our next question is from Chuck Chang, the Canadian Press.
Thank you very much. This question is for Minister Dix. When Minister Dix mentioned about the new bed base going up to 9,880, just hoping to confirm more specific timeline, whether when you mentioned this fall, are we talking about in the next month or so, or are we talking about anytime before the end of the year? And also, what does that actually physically look like? Are you going to actually physically be increasing the space within the hospitals? Are you going to be building more spaces, or how is just trying to get the clarification on how that's going to work?
The key part about increasing the bed base is about staffing and about how we treat beds in the healthcare system. I've said many times at these briefings that we had approximately 9,200 base acute care beds and 2,300 surge beds. And what we've done is established the beds that have the proper equipment that are in place and raise the number, and we're going to build regular staffing around them. The key to those beds is not the space itself. We are, of course, building hospitals, as you know, around BC, but how we treat the beds, how we fund the beds, how we support the beds, and how we staff the beds. And clearly we're in a period where we've gone from a time when 9,200 base beds might be sufficient to a time now when we need to increase that number of beds, and that's what we're doing. So really it's about regularizing those beds and staffing them on a regular basis. We of course staff surge beds now, and we meet the test that comes, but this is an improvement for staff, an improvement for recruitment, and it reflects in our actions and how we organize the healthcare system, how it reflects that in terms of our response. So if we're seeing, as we have this week, 9,700 people in acute care getting care in BC, regularizing 9,880 beds makes sense, and that will happen in October.
Chuck, do you have a follow-up?
Yes, thank you. Also for the minister, you mentioned earlier in the summer that we're seeing the province saw record number of surgeries and things of that nature that really put the emergency room staff and the workers in these settings really under stress, and you were worried about them not getting the usual downtime to somewhat recover before the respiratory season begins. I was wondering, given the updated data regarding the type of infections that you may see, not only from COVID but also from flu, are you confident in the current staffing and the system's ability to handle this if we see another spike, or if you see another sort of rush that perhaps is higher than what the province is projecting?
So we've prepared for respiratory illness season in healthcare in 2020 and 2021 and 2022 and now in 2023. And we've built on what we've learned in those times, and I think our healthcare staff have dealt with it. Let's be clear, every year, even prior to COVID, the busiest months for our hospitals were during respiratory illness season. The point I was making this summer was that we continued to see, even in summer when there typically was fewer people in hospitals in our census, we were continuing to see high healthcare settings, and that is in significant demand on healthcare workers and the whole healthcare community. On surgeries, I think it's a different situation. We, as you remember, in March of 2020, we implemented the surgical renewal program, which meant a very significant training and adding of anesthesiologists, of medical device processing technicians, of operating room nurses. We raised the level of and the hours of surgery we've done in British Columbia such that in the period that we reported on surgical renewal last week, which is from April 1st through to August, we had had 13,000 more surgical hours, operating room hours in British Columbia. It's an extraordinary success. In August, we shattered previous records in terms of numbers of surgeries. But let's be clear, the healthcare system is delivering at all those levels. Surgical renewal, though, shows and demonstrates what planning and a sustained strategy does. It increased our capacity. It increased the number of people working in surgery. It increased the number of surgeries across surgical categories. And that's the kind of planning we need to do. I think part of the problem in the past in healthcare in British Columbia, prior to my time in this position, was a tendency to respond to difficult problems by short-term funding, and then that funding goes away. We changed the base with surgical renewal, as we did in funding long-term care hours, as we've done in primary care, such that we're building out a system year into year with permanent funding and a permanent change in the base. So yes, it's stressful when we do more and more surgeries, but it also means waiting times and our performance compared to other jurisdictions. There's another report today showing us number 2 in an important area of surgery behind PEI over the last number of years. I think all of that shows and has proven itself, and it's not a credit to me, it's a credit to our doctors and nurses and healthcare workers.
Our next question is from Richard Zussman, Global News. Richard.
Dr. Henry, what is a healthcare setting when it comes to this mask mandate? Does this include family doctors' offices, dentist's office, chiropractors? And you worried at all about conflict between people who have gotten used to not wearing a mask, now being told in some areas they have to put a mask back on?
Yeah, so this is all of the healthcare settings that are health authority owned and operated and run, as well as long-term care homes across the board. We don't have directives that affect physicians and dentists and private practitioners in the community. We do provide guidance and recommendations to them, and I know from my own experience that most dentists' offices have never stopped wearing masks, and they wear them as a part of routine. And so it does include, for example, ambulatory care centers that are connected to a hospital. So it would be waiting rooms, offices, where patients are. So it's patient care areas. So the administrative areas where people are, or cafeteria where people are eating, it won't be mandatory in those settings, but it will be in all of the areas where people who are receiving care or who residents are.
Richard, do you have a follow-up?
Yeah, are you worried at all about conflict existing here? And I also want to ask, and this could lead to conflict as well, the issue around the vaccine mandate in the healthcare system. Can you explain to me why you are not requiring healthcare workers to have a full update of their vaccines in terms of getting every booster? I understand you spoke about some natural immunity and that many workers have already received that. Why not make that a requirement of their employment, that healthcare workers have the full list of available COVID vaccines, including all boosters?
Okay. I thought I tried to explain that, but we'll go back. In terms of conflict, I think most people are reasonable. They understand that when you go to a healthcare setting, that's where people are most at risk. Your loved one may be at risk in those settings, and healthcare workers know that as well. So we have ambassadors who will be there to make sure you have access to a mask and that you wear it appropriately in those settings. So yes, it is a requirement. And yes, I do expect that people will comply with that. It's important. It's important as we have more infections in the community that we do what we need to do to protect those people who are most at risk of having severe illness. And frankly, from dying from influenza, from COVID, from RSV. So yes, it is important in the healthcare settings, and I appeal to our better natures. We know that this is a relatively uninvasive, unobtrusive thing that is an important measure in healthcare settings, and I encourage everybody to take that point of view and to make sure that you're doing your part. It protects you and it protects those around you.
Our next question is from Mira Bain. Sorry.
The question in terms of the healthcare worker mandate. So the seroprevalence tells us, we know from data that most healthcare workers have had at least one booster, and also from the data that most healthcare workers have hybrid immunity, which means there's a whole combination of different types of immunity that's out there right now in our healthcare workers. And everybody who's working in our public system has that immunity. So we know that any additional requirement is not going to, it's going to be, it's not needed for one thing, but it would, how do I say this? There's so many different permutations and combinations that there's no one single thing that you could do that would make it work for everybody. So we want to have a period of time between boosters and infection and the updated vaccine. So there's just too many combinations, and we know that we have a high level of baseline protection for healthcare workers. So the mandate remains. Anybody new to the system must get this must get vaccinated with this updated vaccine. So if you're unvaccinated, you're coming in for a job in the healthcare system, you get this updated vaccine and you will be considered protected as we go into this season. So it is a combination. We don't go back to zero when we have time between doses, and we know that we get boosted from being exposed to the virus over time. So that's the rationale behind it. It is the data that shows us that there's a very high level of protection, and as we're going into this season, we want to ensure that we have added protection with this updated vaccine.
Our next question is from Mira Baines, CBC. Mira, go ahead.
Thank you. This question is for Dr. Bonnie Henry. There was a leaked provincial memo, and it says patients, clients, and residents will mask when directed by a healthcare worker or based on personal choice. Why not mandate masks for patients in this regard?
There's a whole bunch of reasons, and partly because residents in long-term care, that's their home, and many people have issues, so we wouldn't expect them to wear a mask all the time in your home. And for patients in healthcare settings, if you come in with a respiratory infection, you'll be asked to put a mask on for sure, and we do that always. But there are reasons why people, because of the health reason that they're seeking care for, might not be able to wear a mask. So the mandate applies to all the healthcare workers, people working in the facility, because they're the people who are there most often and interacting with multiple people over time, as well as visitors. And in terms of residents and patients, it really is dependent on their own clinical condition.
Mira, do you have a follow-up?
Yes, and this is a bit of a longer question. This is a question from a colleague. According to a statement sent to CBC by your ministry, a non-outbreak circumstance in a hospital or long-term care home includes when there is an increased number of COVID-19 cases in a unit or when a variant causes more severe illness among vaccinated people. What is the rationale for not declaring an outbreak to inform patients and their families about these scenarios?
Yeah, I think I'm not sure what that is. I don't know who sent you that statement, but let's be clear around outbreaks. And outbreaks are not just for COVID. We've been doing this for a long time. We have outbreaks of influenza, RSV. Right now we have one, I believe it's parainfluenza. There are a number of viruses that can cause illness and be transmitted in healthcare settings. And we mostly are concerned about long-term care homes because we know people in those settings are more likely to have more severe illness. That's why we're focusing vaccination to make sure that we're boosting up that immunity for influenza and for the ones that we do have vaccines for COVID in long-term care homes as a start. what we have found in terms of COVID over time is that the infections have become relatively mild. And so recently we've had a number of infections in acute care facilities, and as there's more people in the community with infections, there'll be more people in hospital who bring that infection with them. And in some cases, it is a bunch of people, a number of people who've come into a hospital setting, most likely, most commonly, where they have COVID, but it's not because they got it while they were in hospital or that there's transmission happening within the facility. So sometimes these can be managed by just taking individual measures and making sure those people who are sick are isolated and not, and wearing masks and making sure we have what we call additional precautions on those individuals. When we see transmission within the facility between people in the hospital, in the long-term care home, whatever the virus it is, and we need to take additional measures like everybody masking all the time, restricting people from communal events, restricting visitors, that's when it's an outbreak. And we need to be more consistent in how we do that. It's very important that we recognize that these are important for people to know so they can make a decision about whether they're going to go in and visit somebody, for example, if you're at risk yourself, and for communicating these. So we do have a respiratory outbreak, and we call it the VRI, Viral Respiratory Infection Outbreak Manual, that lays out the criteria for when an outbreak is declared or not. There is some discretion because sometimes we have some mild illness that's not being transmitted within a facility where we don't need to take additional measures. And in those cases, it would be just watching and paying attention to who's getting sick and monitoring and supporting those individuals rather than having to take additional measures for the entire unit or the entire home.
Our next question is from Zhao Zhu, Globe and Mail.
Thanks. So I'm curious, are we paying for RSV vaccines? And if so, for who? And if not, why not?
Yeah, so the RSV vaccine, there's just been one approved. There's a number of others, particularly for children, for people who are pregnant, that will protect young infants that are on the horizon. So we're looking forward to that. So the one vaccine is for people who are 65 years of age and older, and it does show some promising good protection. It's unclear how long that protection lasts and how many doses people will need over time. It's also unclear how much will be available in Canada in the coming months. So there's a couple of things that we're looking at. We don't have a publicly funded program here in BC at the moment. What we're waiting for are a couple of things, looking at the National Advisory Committee on Immunization recommendations for use of this vaccine, as well as looking at the implications of the use in our province. You know, who's most likely to benefit, what programs should we have in place that are publicly funded or not. So all of that is underway, but we don't yet have a program in British Columbia and likely won't for this season.
Xiao, do you have a follow-up?
No, thanks.
Our next question is from Lisa Yuzda, City News 1130. Lisa, go ahead.
Hi there, Dr. Henry. Just for the masking, who will enforce it, and will people be asked to leave if they refuse to put one on at a healthcare setting like a hospital?
Yeah, so I hope it doesn't come to that for most people. I think we're reasonable people. And yes, masking is important for those who are visitors in a hospital. And the ambassadors will be there to screen people for symptoms, to make sure they have access to masks, and we'll be asking people to wear them. We do have security if needed, but I would encourage people to to work with people. And we don't go to enforcement first. What we go to is explaining to people the importance of doing this, making sure that they're not putting others at risk, and supporting them in being able to do what we ask them to do.
Lisa, do you have a follow-up?
Yes, with this round of vaccination, I'm wondering, is there a marker for what will make it success? I remember at the beginning, we would, watch the percentages of people who have it within BC. 82%, 83% until we got to the 90s. What will be considered a success this round of vaccinations?
Well, for me, a success is that all of those people who are most at risk are protected, and those of us who live with somebody who's at risk, who provide care to people, are also protected. So I would like to see, especially an increase in children. We know that children don't get a severe disease mostly, but some children can, and we see that reflected in the data from the last few years. But particularly the things that we can do to stop the spread, to slow things down, to make sure that we're doing our best to protect those who are more vulnerable within our families, within our communities, and it protects our healthcare system. So I expect that people will be anxious. I know I'm hearing a lot from people who are waiting for this new vaccine because they don't want to get sick again this year. And this new vaccine works well. We have both products approved for use, and it'll be rolling out in the next few days.
Our next question is from Karen McKinley, Grand Forks Gazette. Karen, go ahead.
Thank you for taking my question. I guess this is more of a question for Minister Dix. Just going back to emergency rooms, you say that we're prepared and you have additional beds coming, but here, especially in interior health, we've been dealing with a rotating emergency room closures, and as we've seen, every year there's a spike in admissions because of respiratory illness. So and of course, people are concerned, just not just because of this, but because of just in general. We're never sure which emergency room is being closed. So, just asking, how is this going to help address like the short-term and long-term issues with community emergency rooms closing for short periods?
So what addresses it is action. That's why we tripled the Practice Ready Assessment Program. Communities such as Oliver, that has had some issues in recent times against return of service, we make decisions and we assign people to Oliver, and communities such as Merritt, and communities such as Grand Forks. So fundamentally, we have to do, especially in rural health, is to ensure that we have the doctors and nurses and nurse practitioners, and now we've, of course, got associate physicians and physician's assistants in different places there to support people in emergency rooms. Secondly, we've got to listen to our communities. In Oliver, for example, we've approved a new way of remunerating, of paying doctors and supporting doctors, which is called an alternative payment method, which is a move away from what's called fee-for-service. And that was developed and working with doctors. And so we're obviously aggressively, both in Grand Forks and in Oliver, taking steps to ensure that we have a maximum response, because we know how difficult it is when an emergency room closure is announced. Thirdly, we have significant measures across Northern Health, but in other communities. For example, Grand Forks has, I think, access to every single incentive program that we have in the provinces in Grand Forks to ensure that we build out both our doctor and nurse capacity in those communities. So, and we've created these provincial networks of nurses and of doctors to support when we don't have enough regular people or people come away sick. Part of the challenge in the healthcare system over the last period, and it's just a change, and it's not necessarily a negative change, it's just a change. Every week in healthcare, we have between 15 and 16,000 people who miss at least one day for illness. It's a huge system. There are hundreds of thousands of people working on it. That's what we have. That typically, prior to that pandemic, was 9,000, and that can happen in different ways in different places, so that if you have people off sick in a community that depends on a small number of people, that can happen. And that's why we're building up these networks of locums, this network and system of travel nurses to support communities. So what we're seeing is, in every level, a massive response. And 5,100 more nurses just this year. That's a response. We're leading Canada in the recruitment of nurses. The new doctors that are coming internationally in the new spaces in medical schools, that's a response. The new allied health programs and the increases in spaces for allied health again. And of course, healthcare assistants, and then expanding the scope of practice of health professions. And what we're seeing is health professions working together as never before. more than 100,000 people have received treatment in community pharmacies since we launched that program in June, which I think is a real success in supporting people, and that helps people get care they need when they need it. So all of these are the actions we take. It's an absolute priority. We do not want to see any emergency rooms closed, and so we're taking every step. In the case of Oliver, which is a community in your region, for example, probably about 50% of the shifts that have been taken in the last number of months have been locum shifts. So that is a massive daily effort by local doctors and by Interior Health to address that problem. Similarly, in Grand Forks, as we say, the list of measures taken and advocated for by local MLA Rolly Russell is impressive. I was happy to meet with the mayor of Grand Forks at the UBCM last week to discuss that and other things we can do to improve the situation in the future, because personally, we haven't arrived there yet in Grand Forks. There's relatively few emergency room closures, but we need the hospital to be open in full, and that's our goal and that's our plan.
Karen, do you have a follow-up?
Yes, and this is more for Dr. Henry. Just of course, in the past pandemic, we would have like super sites and pop-ups for vaccines. Just considering we've got 3 vaccines coming, will there be any plans for perhaps pop-ups or even like a temporary public site?
It's going to be different in different communities, but primarily vaccines will be available quite widely in communities through pharmacies, both the COVID vaccine and the flu vaccine, and we encourage people to get them at the same time, and you'll be able to book the appointments at the same time in a much less complicated way than last year. So pharmacists will be the basis of it. We know that that was easily accessible for people around the province. Public health clinics will also be doing pop-ups and community clinics in different places to offer both vaccines, and particularly for children, because young children can't get their vaccines at pharmacies. So yes, there's different strategies in different places. As well, we know that there's some family physician offices and pediatrician offices who will have vaccines available, particularly for children.
Our next question is from Victor Kaiser, Radio NL. Victor, go ahead.
Hi there. This question's for Minister Dix, I guess, and it's along the lines of the previous one to do with Merritt. I guess the ER there is currently closed. Lack of doctors, we understand. It's the 4th closure, I believe, this month alone. I guess Mayor Mike Getz was supposed to have some kind of a meeting with you, Minister, at the UBCM to talk about these closures. Wondering if you can shed light as to what's going on and what's being done to fix essentially the ER that's along the Coquihalla.
That's right, and I met with Mayor Getz at the UBCM, but he and I regularly talk. He's, as you know, a strong advocate for his community, and we've been working very closely together. I think the municipality, Merritt itself, is contributing to this process by supporting some housing initiatives, working with Interior Health. I think they're doing a very good job, and we're very appreciative of that. What we're seeing across BC, and it was a doctor issue, I think, in the present with Merritt, principally it's been nurses, is the need to continue. We've said this many times, so people understand we have about 38,000 more people working for our healthcare system than when I started as Minister of Health, overwhelmingly nurses and health science professionals and healthcare workers, but also doctors. We have to, of course, it's critical that we be open in the places that people expect us to be open 24/7, 365, and we need to meet that standard. And in Merritt, that means attracting a larger base of doctors and nurses so that we're not as dependent on people coming from other places. So Merritt, like Grand Forks, is the recipient of numerous incentive programs to recruit people to the community. It will benefit, of course, from the Practice Ready Assessment Program, because we'll be assigning people to Merritt who will come against a return of service for 3 years. And we're going to continue to take those actions. And you'll recall, because you're in Kamloops, you'll recall the issues we had in the 2022 year when the discussion was principally around Clearwater. And at that time, we did work on all of these issues, including housing and recruitment. And I believe We've had maybe perhaps one closure, if that, since Labor Day 2022. So we're working hard every day to fill shifts to make sure that we don't see closures, or they happen very rarely moment. But the fundamental thing is to have solutions that mean there are no closures, and that's what we're working for in Merritt and everywhere else.
Victor, do you have a follow-up?
I do, and I'm not sure if this is for the minister or for Dr. Henry, but we're hearing from a couple of city councillors here in Kamloops that were at UBCM that they and a few others have come down with COVID or COVID-like symptoms, after being in one big delegation or one big gathering, if you will. So I'm not sure if that's something the province is aware of. The BC CDC is looking at a potential super spreadery type event just with the number of municipal politicians that were there and the number that are now saying they're unwell.
I've just heard that as well from a number of people who were there, and some of the things I'm hearing about, is multiple different settings and a lot of social settings and lots of people, and it just reminds us that there are viruses out there right now. COVID, SARS-CoV-2 is one of them. In the first slide I showed there's a bit of green, which is enterovirus and adenovirus, and those also have been spreading and cause cold, flu-like symptoms, cough, fever, etc. So yes, I have heard that there's some people with COVID and others who've been unwell after coming together during that week. So whether it's an outbreak or a super spreading event, I haven't seen numbers that would suggest that to me, but we certainly can look into it, and people can report. But importantly, what we're not seeing is large numbers of more severe illness, and that would be something that would be more worrying. I know some people have been quite sick, but we haven't seen a surge in people requiring hospital care, for example. And I think that's a testament to how many people have been vaccinated, and our municipal leaders in particular. And
our last question is from Jennifer Maher, CBC Radio Canada. Jennifer, go ahead.
Hello, the question is in French for Minister Dix. Pouvez-vous résumer en français les mesures que la province prend aujourd'hui pour faire face à la saison des virus respiratoires, notamment les masques et les vaccins?
Premièrement, les vaccins viennent d'arriver, en fait, mais commençant à arriver dans leur totalité début d'octobre, et les populations prioritaires seront invitées à prendre rendez-vous pour les vaccins, n'est-ce pas? Ça, c'est très important, surtout pour des gens qui sont vulnérables, mais tous et toutes les autres aussi. Je pense que c'est absolument essentiel d'être vacciné contre le COVID-19 et la grippe cette année. Et je pense que c'est très important pour tout le monde de prendre cette action. Nous avons un système important, à peu près plus de 1,300 pharmacies, et puis aussi des cliniques, des régies de santé qui seront disponibles pour tout le monde. L'année dernière, on a mené le pays pour notre action contre la grippe, contre l'influenza. L'année dernière, ce qui était très important, et on a vu et on a présenté des renseignements sur l'effet de cette vaccination il y a quelques mois. La Dr. Henry a présenté ces renseignements. Donc, c'était très important. Deuxièmement, il va falloir utiliser dans des hôpitaux et dans d'autres centres médicaux des masques. Bien entendu pour ceux qui travaillent, mais aussi pour ceux qui visitent. C'est important pendant une période une saison respiratoire difficile de protéger ceux qui sont les plus vulnérables. Et parmi ce groupe, c'est des gens qui sont à l'hôpital. Troisièmement, on fait des changements dans le système de santé pour augmenter le nombre de lits de base dans nos hôpitaux de 9200 à 9880. Et ça, c'est un changement qui reflète nos efforts de préparation pour cette saison. Donc, en prendre des actions dans ces trois sens. Et je pense que ce sont des actions importantes. Et vraiment, je demande à tout le monde d'être vacciné, mais aussi de rester chez eux pendant s'ils sont malades. Ça, c'est des questions très importantes et je pense que nous tous, ensemble, seront en mesure de faire face à COVID-19 et la grippe cette année.
Do you have a follow-up?
Oui, you mentioned this a little bit, Dr. Henry mentioned it a little bit in English. Now in French, est-ce que le personnel de la santé aura l'obligation d'être vacciné?
Oui, ça continue à être le cas. Vous savez que nous étions, en tant que province, la seule province au Canada qui a eu la capacité et de mettre en place ces obligations et on va continuer de le faire.
Concludes today's event. Thank you so much.